Kari, how are you?
Afternoon to you too. I'm fine, thank you.
Karibu sana. Would you mind just putting your video on when you're doing your presentation?
If I'm,
yes.
You are sure you really want to see me like this?
Yes, we do. Yes, we do. Yes, we do. So, welcome very much. Thank you very much for offering us your time. I know you're in a busy schedule, but thank you so much. So, karibu sana to our recording of this webinar on the topic, the ear, hearing loss and hearing aid. So we have started screen sharing. So you just give us an overview. Before that, just say your name to our viewers and just what you do first before we head to the presentation. Karibu.
Thank you very much. So good afternoon, everyone. My name is Dr. Lillian Mokoh, and I am an ENT surgeon. I practice at Kenyatta University Teaching and Referral Hospital, and I'm also a volunteer surgeon with Operation Eardrop Kenya. And today I will be discussing about the ear and hearing care in an easy way. And the objective is to make you understand basically about the ear and how it works and what is required for you to do whenever you have a problem with your ear. So perhaps we can start by looking at our ear. The ear is generally looks like the picture as shown on the screen. And the ear is made up of, or is comprised of, three parts. We have the outer ear, which is the one labeled as the ear canal. We have the middle ear, which comprises mainly of a space, which is basically called the middle ear. And that space has three bones, which are the ossicles. They are the bones that vibrate to transmit sound into the organ of hearing. And that part also has a tube that connects to the back of the nose. Then we have the inner ear, which is the structure of the ear that you can see there labeled up. And the inner ear is the organ of hearing and balance. So the function of the ears is to help us to hear and to hear and to maintain body balance. So the inner ear is divided into two parts. One part is for hearing, one part is for balance, and it is found inside the bone that houses our brain. And so it is also connected with the brain because the brain is the one that listens, that helps us to understand what is being said. So when we go to the next step, we will learn that in this next slide, please. The next slide. So you will, when you want to talk about how the ear works, we are going to concentrate on how the ear works to help us to hear. And when you look at the pictures we had said, in the next picture, we say that sound usually travels in waves, and we usually measure the loudness of sound in decibels. We also have a variable called frequency, which is the rate of vibrations that are available for that particular sound that we are listening to. So these are the three main things that we need to know so that now we can understand how the ear works. So the next slide will tell us about how the ear works. Next slide, please. And that one is showing us how the mechanics of hearing, that is how the ear works. As I said before, sound travels in waves. So the blue arrows are showing us how sound travels in order for us to hear. So it goes in through the ear canal. And at the end of the ear canal, we have the eardrum, which will vibrate and transmit sounds through the bones up there. These are the bones of the middle ear. And the work of the bones of the middle ear is to amplify sound. So they make that sound louder than it was, in order for the ear or for the brain to be able to perceive it well and clearly. After the vibrations of the small bones that lead to amplification of sound, that sound is transferred to the inner part of the ear. And from the inner ear, that is where we have the organ of hearing, which transmits that sound from the waves and the vibrations that were there and makes it to become electrical energy that is able to travel through our nerves. There's a nerve that is involved in hearing, and it travels all the way up to the midbrain and into the part of the brain that is involved in hearing. And in the brain, what happens is that that sound is processed and you're able to understand what is being said for you. And in return, you're able to know what is the appropriate response in order for you to hear. So that is how we basically are able to hear, and we respond by speaking. So basically, if you cannot hear, then it is very difficult for you to speak. And that is why even in young children, whenever they are not able to speak in good time, it is usually one of the signs that this child could probably not be hearing or maybe not hearing well. We can now go to the next slide. Next slide, please. So when somebody is not able to hear, we say that a person has a hearing loss. And a hearing loss is to say that, not to say that you're deaf or you have a problem, but a hearing loss means that you have a decline in the normal level of hearing compared to other people of your age. Again, because hearing is different in different ages. As you grow older, you're not able to hear as well as when you are young. And so we measure that whenever a person has a decline below what is expected for their age, we say they have a hearing loss. A person who has hearing impairment is someone who has a significant degree of hearing loss that can be ranged from either mild to profound. So any person, whether you have a very small hearing loss or a very large hearing loss, can be termed as a person who is hearing impaired for as long as their level of hearing is below. A person who is hard of hearing means that this is somebody who has a hearing loss but can hear something, especially when they use a device that is something like a hearing aid in order to hear. That is a device that is used to amplify sound. Those are the group of people that we call hard of hearing. They are able to hear, but they have a residual form of hearing. Then a deaf person is somebody who has a severe hearing loss. So they have extremely or very little or no function in hearing. And this is somebody who basically is not able to perceive any form of sound. And so they might not be able to be helped by using an auditory device. This is something like a hearing aid. Next slide. When we talk about causes of hearing loss, as I said before, hearing loss, hearing loss, hearing is something that varies from age to age. And hearing is a function of the body that is utilized every single day of our lives. So you find that any day that you are out there, you are exposed to something that can have damage or that can affect your hearing. So causes of hearing loss, usually we say they occur across an individual's lifetime. So, and we divide them into causes that occur when the mother is still pregnant. These are things like infections, things like medications that are taken by pregnant mothers, infection that can be gotten by a mother who is pregnant, or sometimes genetic malformations or any other malformations that can happen to an individual when they are still in the mother's womb and while they are undergoing the normal development. Then you find that those things can cause a hearing loss. So it could be genetic, it could be infections, or it could be medications taken by the pregnant mother. Even things as simple as the nutrition of the pregnant mother. And this is why we insist that mothers should attend the antenatal clinic. Mothers who are pregnant should not pre-medicate themselves with medication anyhowly without seeing a doctor, so that they can be able to follow up how their child is developing, and they can protect their child from developing some problems such as hearing loss. Now, the next stage is when a child is born up to 5 years. At that stage, you have children who are usually quite delicate because they're just new into the world, and there are several things that can affect them. The most common thing that affects children at this age and causes them to have a problem with hearing are infections. infections such as meningitis, infections of the ear. A lot of small children get a lot of infections, that is, they get a lot of flus and colds. And as I told you in the diagram above, the middle part of the ear is connected to the nose. So each time a child has a flu, they can easily get an infection that will spread from the nose into the ear, and that can cause changes in the part of the ear, and that can make the child have a hearing loss. So any infection in a child who's less than 5 years can affect them and affect their hearing. The other thing is things such as medication. Medication given to children can easily, medication given to a person across their life. There's some medications that can affect your hearing. So again, that can also cause a hearing loss during infancy and in the early childhood years. Of emphasis is that during the early childhood years, the most common cause of hearing problems is infections. In childhood and adolescence, especially, and going all the way to working age and young adults, you can be exposed to several things. The standard, again, any medication that you take that can affect your hearing, or any medication that you take can easily affect your ears and cause you to have a hearing loss, especially if that particular medication is known to cause that. That is drugs such as drugs used for TB and some antibiotics, and even drugs that are used for treatment of certain diseases such as cancer. Again, during this period of time, the most common cause of ear problems, again, ear problems can easily be caused by practices, and that is day-to-day lifestyle practices such as use of earphones, and use of or listening using very high volume, using personal listening devices. Between adolescents and young adults, these are the people who expose themselves to concerts, they go to the disco, they listen to music using the earphones. At this stage, each time you're listening to music at harmfully high levels, you know that you're putting your ears at risk, and you're putting yourself at risk for developing a hearing loss. Again, occupation, there's some people who work with substances, that is either chemicals or metals, or they are found in industries that generate a lot of noise. All those things that you are exposed to can also lead you to developing a hearing loss as an adult or as a youth or as an adolescent. And finally, we have older people. Older people also, normally as you age, your ear ages, and so your hearing level comes down as a result of age. So the take home is that it's being born with ears that can hear does not mean that you cannot develop a hearing loss in the course of your life. And so it is very important that you're able to know what are the things that I'm exposing myself to that can easily cause damage to my ear, so that you can protect yourself. When we look at this problem of ear and hearing loss, why are we talking about hearing loss? Because in the world, it has been reported that individuals are exposing themselves, and we are having more and more people having problems in hearing loss. Currently, today in the world, 1 in every 5 people have a hearing loss. So that means if you walk wherever you are, if you stopped and counted 5 people, at least 1 is at risk of developing hearing loss. And by 2050, this is going to be so bad such that out of 2 young people, 1 person will be having a hearing loss. Now, the sad thing is that 80% of the people who are at risk of developing the hearing loss are found in countries such as our country. This is low to middle income countries. That is countries that are in the developing world, and our country is one of them. So that means that you and I need to learn more about our ears, because our hearing is at risk, and we need to know what to do in order to protect ourselves, because once you lose your hearing, it cannot come back. It is irreversible. Next slide. Next slide, please. Now, if you remember the picture we saw earlier about the stages or the different stages of our lives that you can find yourselves having a hearing loss. That is what we look at when we say, how do we prevent ourselves from developing hearing loss? Right from the time before you're born or before you're conceived. First, it is immunization. So pregnant mothers who should attend the ANC clinic, they should get immunized and they should get tested for any illnesses. If they attend the ANC and they are followed up well, then there are less chances that they can give birth to children who have a hearing loss. Once the children are born, again, they should be immunized. They should be immunized against as per the recommended schedule of immunization. And that immunization usually protects them from diseases that can affect your hearing or that can cause a hearing loss or that can affect your health and lead to complications such as hearing loss. So immunization is also very important, both of the pregnant mother and of the newly born child. Again, good maternal and child care practices. So making sure that your child has received proper nutrition, has received the proper medication, avoiding interventions such as giving your child medication at home without seeking care. As we have seen, medication can easily cause hearing loss, especially if it is unmonitored or if it is just without a medical personnel prescribing the proper dose and the proper medication. Again, genetic counseling. We find that some of the issues or some of the causes of hearing loss is genetic. As I said, before you're born, some genes can influence whether you hear or not, and they can cause you to have a hearing loss, or they can cause you to have general conditions that you're born with that are associated, or that also have a hearing loss associated with them. These are children such as children with cerebral palsy, children with Down syndrome. These children are usually more at risk of getting hearing loss, and this is where now you get cancelled. So if you have a genetic disease that can lead to children with hearing loss, you're cancelled, advised on what to do. If you have a child who already has a condition that is associated with hearing loss, they're checked and you're cancelled for that. And of importance, the people who are already deaf, we also take them through counseling to try and see, or to let them know that there's a possibility that they can also pass the genes to their unborn children, and so they can also get children who have a hearing loss. Again, early treatment and identification of ear diseases, whether you're an adult or a child, whenever you have a problem with your ears, whether it is pus coming out, whether it is pain, whether it is a sound or a ringing sound, you should go to hospital as soon as possible, see an ENT doctor, and make sure that your ears are checked, and if there's a problem, they are treated in good time. A use of safe listening practices, so avoiding using earphones for very long hours, or using earphones at very high loud volumes, or exposing your ears to extremely loud sounds that can be damaging to your ears. You should protect yourself from that. If you're working in a place that has very loud noise, or if you're working in a place that has chemicals that can affect your hearing, then you should wear protective gears. The people who even work in jua kali, there's a lot of noise. The people who work in the matatus, that noise is very dangerous to your ears. And eventually, over a few years, you find yourself having problems with hearing. So you should always protect your ears by use of earplugs and other protective equipment that can either be provided at your workplace by your employer, or you can buy for yourselves, basically to protect your ears. You should also, if you're working in such institutions, you should also make sure that every year you undergo a hearing test. And this is mainly to keep track and to make sure that your ears are not being exposed to dangerous levels of sound. And finally, ototoxicity monitoring. This one is for us, doctors. Whenever we give a patient medication that can cause hearing loss, this is how we are able to monitor the level of the drugs and check that. So how do you know if you have a child or if you have somebody at home, how do you know that this child is not able to hear? Then the things that tell us, as I had said before, if you cannot hear, then you cannot talk or you cannot respond. And so the first thing is, if you have a child who does not react normally to sound, if you have a very small child and people can make noise and that child sleeps throughout that noise, then you want to ask yourself, can my child hear very well? Because we know it is not normal. Children are usually woken up by noise, especially if it is in a high, loud level. If you find your child is not startled by anything, if a cup falls or a door bangs and your child is unmoved, they do not even look into that direction, then you know that probably that child has a hearing loss. If your child delays in terms of speech, so you have a child who is not even making the bubbling sound, a child who is not trying to mimic what is being said, or a child who normally by the time a child is 1 year, or by the time a child is around 9 months, they should be able to be making some sounds that sound a little bit between 9 months and 1 year. They should be able to make sounds that are intelligible, or sounds that sound like something that you can make out of, even if it is just mama or dada or baba. So if a child reaches almost 2 years, they are not speaking, they are not saying proper words. By the time they're 3 years, they should be able to construct sentences that make sense. By the time they are either simple sentences, by the time they are 5 years, a child should be able to communicate fluently and very well. If you have a child who is not achieving or who is not at par with their age mates in terms of speaking, then you know this child probably has a difficulty with hearing. Again, difficulty developing the correct sounds of speech. So if you have a child who is not able to make the right sound of speech, even after you correct them over and over, they probably have a hearing loss. And finally, you have balance problems and learning difficulties. Again, you cannot be taught, you cannot be contained, you cannot be taught manners, you cannot understand when you're being told to stop something if you cannot hear. And so you find that most of the children who are not able to hear, most people out there say, this child is very rude, this child is very naughty, and it is because that child does what they want, and it is largely because they are not able to hear. So they are not able to follow instructions. So such a child should be taken to hospital and assessed for hearing loss. If it is an adult, again, if you find yourself, you're having difficulty understanding words, especially when somebody is speaking to you in a noisy environment, yet other people are able to understand those words, then you probably have a hearing problem. If you're asking other people to speak, either to repeat what they're saying or to speak at a slower pace so that you can understand what you're saying, you probably have a hearing loss. If you find that speech sounds like it is coming from a distance, either it is muffled or it is lower than normal, then you probably have a problem with hearing. And eventually, if you find yourself, you have to keep turning up the volume, or compared to other people in your environment, if the volume you listen to is at an uncomfortably high level, then there's a probability that you have a problem with your hearing. And finally, this leads to social withdrawal and depression. We know hearing is what helps us to connect to others, able to speak, that's how you're able to interact and socialize. And so these people end up being withdrawn. Now, when you come to us and you have a hearing loss, what do? We said we do a hearing test, and in the hearing test, we look at what is the lowest level of sound that you're able to hear. And on this hearing test, we present it as a graph. So we have a graph here that has a normal right ear. That is to show you that the hearing is at 20 and above. But again, we said we measure it according to your age. So it is up to the doctor to tell you what your exact level is. But anything that comes below 20 then becomes a problem. So if you have a graph that is looking like the one on the left ear, even lower than that, then you know that you probably have a hearing loss. That is after you have done the hearing test. This is the most commonly done hearing test. It is called a pure tone audiogram. We have other hearing tests that are a bit more complicated and are more complex, but this is a basic for everyone to know. The others, they are done, and they are done for children or even for adults. Now, when we find that you're not able to hear very well, then according to the level of hearing, we recommend, again, as I said, hearing loss is usually irreversible. That means if you develop a hearing loss, the doctor is not able to take you back to the normal level of hearing. That damage that has happened to your ear is usually permanent. And so most of the times we prescribe hearing aids. Hearing aid is just basically a device that usually takes the sound that is coming into the ear and amplifies it and then delivers it to the ear at a higher level. So that even if your middle ear is working, it will have made that sound that you received to be louder, and then it will be made much louder in order for your ear to be able to perceive and translate that sound to the brain. You can either have an analog one that just directly amplifies sound, or a digital one, meaning that the digital one is programmed to suit your type of hearing capacity. And it can also have special features such as Bluetooth, so that you can answer your phone with it, so that you can listen to the TV with it. So that is what we mean by analog and digital. Currently, because of the advancement in technology and in the world, we are currently only recommending for people to use the digital hearing aids. But because of cost and such things, then we usually, the needs of the patient are met once you go to hospital according to what you're able to get and how the problem that you've presented with. Types of hearing aids, we have hearing aids that we have a variety of hearing aids. Again, as I said, they depend on your type, on your level of hearing. And these hearing aids, you find that they can be visible. The most common hearing aid, they can either be very visible, which is the most common hearing aid that people put behind the ear, or they can be very, very tiny, such that people are not even able to see anything, or they're not able to see that you have anything in your ear. So those are the different types of hearing aids. You have one that is invisible in the canal. You can have one that is in the ear. You can see in the ear is just visible over there on the canal. You can have one completely inside the canal. So it is only the tip of the hearing aid that is visible. Then you can have the one that has a receiver in the canal. This is a very small hearing aid that you can barely see, but it also has something that receives the sound in the canal. So next sound. So these hearing aids, again, different people, different needs, different problems, then they take different hearing aids. Other forms of hearing rehabilitation include use of things such as cochlear implants. A cochlear implant is an electronic device that is put in the ear. This one is indicated for people who have a severe type of hearing loss, where they are not able to, they do not, in the severe hearing loss, we said that they have little to no residual hearing. Their organ of hearing is not able to perceive any sound. And so these people who have cochlear implants, it basically takes up the sound and transmits directly the electrical signal to the brain. We have implantable aids. Again, you can take your child to a school for the deaf where they undergo sign language training, and sign language is a form of, it's usually a form of communication and a form of hearing rehabilitation, where they're taught and they undergo rehabilitation for the hearing loss. They can also be taught how to do speech, lip reading, and undergo speech therapy for those who are not able to pronounce very well. Next slide, please. So now that is basically about what we do when you come to us. But what are you supposed to do every day? What are we supposed to do every day so that we can protect our ears? So some of the things are: one, safe listening practices, such as one, keeping the volume to below 60%, protecting your ears whenever you're in a noisy environment, that is using ear, avoiding the use of cotton buds. Cotton buds lead to wax impaction, that is, they push the wax in the ear, which eventually blocks your ears. Your ears are self-cleaning, so you do not need to use cotton buds to clean them. They usually clean themselves. Then you're not supposed to swim, or you're not supposed to put dirty water into your ears. If you do that, then you risk getting ear infections. If you have an ear that has pus or any fluid flowing out of it, then you should go to the hospital. You should not ignore. Most of the times, ear infections are not painful. you just hear or you just feel some pus or some liquid flowing out of the ear canal. So you should always seek medication, because that can lead to damage, permanent damage to your ears. And again, avoiding home treatment remedies. There are people who use all sorts of things in their ears. There are people who put gunpowder for the ear infections. We see also a lot of people who put mafuta ya kuku, mafuta ya kondoo. All those remedies, home remedies for ear conditions, are not recommended. If you have an ear problem, or if you suspect your child has an ear problem, it is best you take them to hospital for the intervention. Again, because we said even things such as chemicals can affect your hearing, and so you don't want to put anything you don't know if it is safe, and you don't know if it is safe into your ears. Next slide. So that is basically the end of our general talk on ear and hearing care, and I will end by using a quote from Helen Keller. Helen Keller is one of the ladies who is accomplished. She's a Nobel Peace Award winner, and she was both blind and deaf, and she was asked to describe her disabilities, and she said that blindness separates us from things, but deafness separates us from people. So this emphasizes the importance of us taking care of our ears. Whenever you have a problem such as a hearing loss, you're not able to socialize or interact, and so you should take care of your ears, and you should be keen. If you have a person who has a problem with hearing, they should get intervention as early as possible, so that they are able to be rehabilitated in order for them to go back to connecting with people and be able to communicate with people for their various practices. Thank you.
Oh, Dr. Thank you very much for that elaborate presentation. We truly appreciate. And just to pick up from the last statement about early intervention. So here is a caregiver, a parent, and they've started noticing those two small signs, especially for children. And Gifted Gems is all about early intervention for children. So where can a parent go to? Which hospital can they go to, both in the urban and in the rural setup? Which doctor should they first go to seek for help?
So generally, in the country, if you go to any public hospital and your child has a problem with with their ears, then there's a referral pathway where if there's no specialist who can treat that child, they're sent to the next institution. But I would say that all public hospitals that are county referral hospitals should have an ear and hearing care specialist. So if you have a problem, if you have a child or if you have a problem with your ears and you go to a county referral hospital, you're highly likely to get an ENT doctor, because hearing issues require you to be seen by a specialist who is an ENT surgeon or an ENT clinician. And from there, they will be able to evaluate and intervene. Again, the national hospitals, that is Kenyatta National Hospital, Moi Teaching and Referral Hospital, and Kenyatta University Teaching and Referral Hospital, they have specialists who will be able to do that kind of care. So generally, from the county hospitals and above, you can see that. In the private sector, I don't want to talk about it because different hospitals have different needs. But what you need to ask for is asking for an ENT specialist, that is an ear, nose, and throat specialist. Then they will be able to sort you out. So whatever private institution or clinic you go to, as long as they're able to treat ear infections. Other than that, all medical personnel, including medical officers, clinical officers, nurses, they're able to pick out if you have a problem with the ear that requires you to be referred. Then they will refer you to the correct person. So even just seeing a general doctor in a general hospital, they will be able to examine you, and if they feel the problem is in your ears, they will be able to send you to the right specialist.
Thank you very much. And in those hospitals you mentioned, do they accept NHIF cards for treatment or for assessment?
Now, unfortunately, ear and problems to do with the ear, consultation fee Most of the hearing aids, they're not covered by most insurances in the country. So you find that NHIF and other insurances are not able to cover. If you're a civil servant, or if you're in the police, or if you're a teacher in the Teacher Service Commission, their insurances covers them partly to be able to receive hearing aids and to be able to do even to receive cochlear implants in the government, and that is NHIF. But other than that, the general population, it is not yet covered. It is yet to start covering them, and maybe that is one of the things that people should push for. Private insurances, it depends on the type of insurance. Some cover, some do not cover.
Okay, thank you very much, Dr. And I know you work with Operation Eardrop Kenya, so I'll just give you this platform just to tell us what Operation Eardrop Kenya do, what activities they have been doing so far.
So Operation Eardrop is a non-governmental organization that specifically focuses on issues to do with ear and hearing care. We are mainly, we are just a non-governmental organization full of volunteer surgeons, volunteer audiologists. And so what we do is that we are just ENT surgeons and audiologists who walk around. We sensitize people on hearing loss. We talk about prevention strategies on hearing loss. We go to hospitals, we go to schools and talk about it. We also conduct hearing screening in various places, that is in schools, during public health campaigns. We basically do sensitization and teaching of people on ear and hearing care. Other than that, we collaborate with institutions such as the hospitals, and we are able to, after we do the screenings, we're able to follow up the patients. Those of them who require hearing aids, we collaborate using foundations such as the Starkey Foundation, and we're able to give people affordable, or we're able to give people hearing aids depending on whether they will be free or they will be subsidized. Again, Operation Eardrop is also able to conduct surgeries. Some of the interventions for ear problems can be corrected through surgery. So we also collaborate with hospitals and we perform the surgeries, and they're usually done for free. And we travel all around the country just doing that work.
Wow. Thank you very much, Dr. Lillian, for elaborating to us about the ear hearing loss and the hearing aid. And I know caregivers outside there, even as young people, teens, adults, right now, they know how to take good care of their ears, and will be much more better. We listen to our bodies so that you can be able to, because you've mentioned, you cannot, it doesn't have pain. So let us learn to also listen to our bodies, so that anytime you have something to do with your ear, you can quickly rush to hospital, because you've mentioned once the hearing loss has gone, you can never recover. So thank you so much, Dr. I don't know whether you want to give out your contacts or Operation Eardrop contacts, but just in case someone wants to get through you, they can do that. I'll allow you to do that if you may.
I think I will allow you to, you can project my contacts, or they can reach out through you, because we don't have a physical location as Operation Eardrop. And as I said, we are volunteers, so we attend to people on availability. And so you can share my number, or you can let people come through you. You can be our channel. The organization can be a channel for you to contact us. Anytime you contact us, we will be able to work with you and intervene where we can. So thank you. I don't think I have much to say.
That is enough. Thank you so much, and God bless you. Just in case of any questions, once they'll be taken, we will definitely come back to you and answer our viewers. So thank you very much, Dr. and God bless you.
Thank you. God bless you too.
Okay, and that is it from us from Gifted Gems. Thank you very much for viewing us, and just to learn and engage more about the ear. So if you have any questions, please feel free to write them on the comment section so that we can be able to answer you in the future. For now, thank you very much. We will leave you with a clip on what we have been doing so far as Gifted Gems as we conclude. So thank you very much and have a blessed evening. Thank you.